But in studio right now, our good friend, Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital with us. And Joe, good morning. Thanks for jumping on board with us. And you wanted to start with stress fractures.
Well, everybody has been cooped up inside sports-wise for months now.
Yeah.
And finally, we're moving outside, and our spring sports are going to be playing virtually every day, I think, to make up all the...
Yeah, I know that.
But when everybody's inside, one of the things related to weight training and other things, we know about the injury called a stress fracture. But the most common stress fracture in the body that we just see so much down at our place, and I want to get the word out. I think we're doing better than we were years ago with this stress fracture, but it's in the low back. It is a small hairline fracture, a microfracture that occurs around the fourth or fifth lumbar vertebrae, which is all the way down at the bottom of the vertebrae in the low back. It's exceedingly common. You would not believe this, but we see 500, 600, 700 a year at our center.
Goodness.
It's an exceedingly common, and kids just have this persistent back pain that's not getting better. And in the old days, a lot of people would say it's a pulled muscle, and kids would just continue to play with it, and we'd end up with some complications sometimes. Nowadays, I think more of the medical people, the coaches, the parents are more informed. But when I get a chance, I want to talk about this. This stress fracture is called spondylolysis is the name of it. It has its own name because it's so common. Mm-hmm. And so when somebody's over 2, 3, 4 weeks of back pain, now a time that we get it is kids weight training, and weight training pretty hard, particularly when they're still growing. So this is the junior high kid, 7th grade, 8th grade, 9th grader that hasn't developed yet, that goes in the weight room trying to lift the same kind of weights as the high school juniors and seniors. They're doing a lot of squat presses particular to this. Deadlift is also one of the lifts that they do. Very high percentage in weight training, and our guys doing a lot of weightlifting at a young age, or our females, a lot of our girls weight training now, improper form, too much weight, still growing a lot, and then they get this chronic back pain and they get a stress fracture in the low back that is very common.
So how long to heal on these things?
These things take about 2 to 3 months to heal. So nobody likes that. Everybody is involved in their sport. The number one sport overall is gymnastics. If you've been to gym, you see at the Olympic time, all the arching and twisting they do. So it's with repetitive arching and twisting and not enough yet core strength to protect the spine, and these stress fractures pop up. If you go to a gymnastic gym, you might see 1 out of every 3 or 4 girls wearing a brace. So for a period of time, they wear a brace and rest, and then they rehabilitate and rebuild up all of those core muscles again, so those muscles are strong, and then they go back to sport in about 3 months. Now, does everybody wait the 3 months? No. Do a lot of kids push back in a month? Yeah, they do. Do kids flare up again? Yeah, they do. It has a good rate of kids healing. About 80% of kids heal. But we get 20% who go on to a slippage of the vertebrae, who go on to some chronic pain of the vertebrae, or go on to disc problems later on. So it does have complications. When it's well treated, we catch it early. 80% of kids do really well. When it's not treated well, they come in our office. It's been 9 months, 12 months. I see all the changes on the plain x-ray. Initially, when we catch it early, you don't see anything on the x-ray because it's a microfracture. But when you see it later, there's slippage and non-union, we call it, where it didn't heal well. And so it's a stress fracture that we really need to be aware of, particularly in our gymnasts, our dancers, our long jumpers, our pole vaulters. I saw a pole vaulter yesterday. Anything where you're arching, or the kids that have been weightlifting and weight training at higher rates than they really should for their age and their stage of skeletal maturity. And that's why we say total different weightlifting program for your junior high kids and your high school kids. Be aware of that. This chronic back pain, don't just let it go on and on. We got to do something about it.
Preventative measures with this, because weightlifting and other things seem to have a role in these fractures. Is there anything preventive? I don't know. Keeping your weight down? What are some preventative measures?
For sure. And so do not get me wrong. Weight training is an absolute must nowadays and absolutely essential to sports like football. But everybody does it. Baseball, soccer, everybody, basketball teams. Now, they are getting into different weight training plans, but the prevention part is not starting at too young of an age, not starting when the body is still maturing. If a kid is growing a lot in a junior high kid, don't just send them off to the weight room to do the same things the high school kids do. That's the number one preventative thing we can do in the weight room. Don't lift too many days in a row, never more than 3 days, never more than a half hour. Be careful of those overhead lifts where you put all the weight on your shoulders, like squat and deadlift in the younger kids. In the high school kids, that's okay. I'm definitely not demonizing, or saying anything bad. Weight training is a big part of developing young athletes, but it should be done well. And if it's a junior high kid, they should be in there with somebody who is supervising them at all times. When you get to the later high school kids, the sophomores and juniors and the well-developed kids, they can be in the weight room and have their own programs and lifting on their own, but supervised weight training programs for our younger kids.
Okay, now when we talk, and just as for parents and guardians, grandparents out there listening, when we talk about the pain in the back so they know what this might be.
Yes.
Is it a piercing pain? Is it an ache? Clue them in a little bit,
Yeah,
Joe.
it will be pain with activities of daily living even. So the way it starts is, I have a little bit of pain when I play. Oh my gosh, I have pain when I go to bed at night. Now I have pain while I'm sitting in school for an hour. All day pain is not a good thing. Get them in to be evaluated. I'd say the period of time is 3 or 4 weeks or a month. If they're saying they have pain for more than 3 or 4 weeks straight, if it's getting into activities of daily living like school and sleep, get them in and get it evaluated. And we're really particular about trying to get to the bottom of it and figuring out if it is this very, very common stress fracture. There could be 5 a day in our office.
Wow. Dr. Joe Congeni with us, Sports Medicine Center, Akron Children's Hospital. You heard him talking about weight training. LeBron James going to play every game this year. He has extensive weight training programs that he goes through in the off season, so certainly it has helped him. So with the NBA playoffs upon us,
yes.
I'm going to segue into that, Joe.
Yes.
We found out last week that Kyrie Irving is going to miss all of the playoffs. They're saying 3 to 4 month recovery time here of taking screws out of his knee. Medical perspective, give us your opinion here with Kyrie Irving.
Yeah, there are a couple of red flags with Kyrie Irving, and you start by saying LeBron James, he's like no one we've ever seen. Before our eyes, seeing him, and you see how many NBA guys are missing some games, injured, in a career of 15 years staying healthy the way that guy has. Absolutely unbelievable, off the charts, once-in-a-generation player. Kyrie, always been a little banged up. We worried about his shoulder when he got banged up when he was with us. Mm-hmm. And then, of course, the 15 finals. With him in the 15 finals, maybe we have 2 championships. He breaks the patella. So the interesting thing is the Boston medical team tells us a few weeks ago he's just going to take a few games off, and that's all he's going to need because it's not a structural injury. And what they meant by that is most injuries to pro players and adults, when they get into bad knee problems, they're deeper in the knee, like torn cartilage, torn ACLs that lead to arthritis later on. The patella is a totally different joint. As you know, it's on top or the front part of the kneecap, the front part of the knee, and the rounded kneecap. He fractured that kneecap. Never really heard for sure whether it was all from overload and overuse, but remember, he limped around in that 15 playoffs before it broke all the way. But to fix it when it's significant like that, you need to put hardware in there. A screw, and there also was talk of a K-wire in there too. Now, he may have re-aggravated that. These screws can come loose. They can become symptomatic. And of course, they thought with a little bit of rest it would quiet down. It didn't. They said it wasn't structural. Well, but this is a big deal. Then they said, okay, we got to take the screws off. But when they got in there, one of the unfortunate things is there's talk there wasn't some infection in there too. And infection with surgery is never a good thing. And one of the things I read was they think he may need to have another surgery at another time down the road. So this is not a structural injury. They were right about that. That was not the torn cartilage, torn ACL that we normally see. Patellar fractures at that level, not all that common. But when you have one that has some issues like even getting the hardware out where you fixed it and even some infection in it, there is some long-term concern about Kyrie Irving.
Well, it's interesting you bring that up. I was just doing some reading last night, 2 different players from the NFL whose careers ended soon. And I always wondered what happened to these guys. And they had ankle injuries.
Yeah.
And they went in to fix the tendons around the ankle, found infection.
Right.
and their careers were over.
Yeah.
Explain that aspect.
Well,
I don't
mean,
think a lot. What happens when an infection gets in there? What causes major problems?
It causes major problems, and there's no doubt about it. And the rates are very low, and our surgeons are so good. But they'll tell you if you have to have a surgery, they'll tell you there's a 2% risk or a 3% risk, a very low risk, and that's typically what it is. This one's odd because if you're going to get an infection because of a foreign body in the knee, when you have to put hardware in, and a lot of bad injuries, you have to put screws or rods or pins in. We have to do that in sports surgery. Is those things can be an area where these infections can collect in the joint, but usually that would be right after the surgery. It wouldn't be later like this. That didn't make any sense about the issue with Kyrie, and maybe it was just, again, bad fortune that happened to him, that in the 2% or the really rarity. But when you have hardware in the knee, there is a higher risk and incidence of surgery. When you have a later redo surgery, there is an increased risk. But those are small risks, but it can be a really big deal. Let's really hope for Kyrie because he's a wonderful player, and what a great to see that it was a small localized infection that they very easily took care of, that won't be a big problem down the road, that it didn't do a lot of damage in his knee beforehand. But of course, only the surgeons that saw it and see it now and see the imaging later know whether they got everything with the infection. It might have been just a small side infection that was 2%. Let's hope it wasn't a more advanced infection, and those kinds of things are absolutely, you said it, Ray, career-threatening, can be end-of-career kind of things.
All right, Joe. Good stuff this morning. Thanks for coming in.
All right, Ray. Thanks.
Good education. Dr. Joe Congeni, Sports Medicine Center at Akron Children's Hospital, joining us this morning.